Welcome back, everyone. Today we're taking a deep dive into a really intriguing case study about a 2-year-old Airedale Terrier.
Sure.
This dog suddenly developed some pretty significant neurological problems.
Yeah.
We're talking about things like weakness on one side of its body, difficulty coordinating movement, and even trouble sensing where its limbs were in space.
Right, those classic neurological signs.
Exactly. Those are the big red flags right off the bat.
Mm-hmm.
But then the bloodwork results added a whole other layer of complexity to this case.
Oh.
They showed a significantly low Von-Willebrand factor, which is, it's crucial for proper blood clotting.
Right. Von-Willebrand factor. That's a key component of the whole coagulation cascade.
Absolutely. So now the vets were dealing with not only neurological signs, but also a potential bleeding disorder.
Mm-hmm.
So to get a clearer picture of what was going on, they did both an MRI and a CT scan.
I see.
And the MRI revealed a hemorrhage, a bleed, in the right parietal lobe of the brain. And that finding definitely helped explain the neurological symptoms that were being seen.
Makes sense.
But the CT scan showed something a little bit unusual.
Uh-oh.
It showed an unusual pattern in the lungs,
Interesting.
suggesting there might be a parasitic infection going on. So now we've got this potential lung issue alongside a brain bleed.
Yeah.
Seems like a strange combination at first glance. So how do we connect those two?
Well, this is where the parasite, Angiostrongylus vasorum, enters the picture. You've probably heard of this one. It's a lungworm that's becoming increasingly prevalent, especially over in Europe.
Right. Angiostrongylus vasorum, definitely a parasite we need to be more aware of.
Yeah, absolutely. And it's notorious for causing bleeding disorders in dogs, including problems with, you guessed it, von Willebrand factor.
So the lungworm could be the link between these seemingly disparate issues.
Mm-hmm.
But the case report mentioned that the initial SNAP test for a vasorum was negative.
Right, but a subsequent Berman fecal test actually turned out to be positive. This really highlights the importance of understanding the limitations of different diagnostic tests, Sometimes you have to be persistent with further testing if you still have a strong suspicion.
So can you break down those two tests for us? Like, what are the differences between the SNAP test and the Berman test?
Sure. The SNAP test looks for specific antigens in the blood that indicate the presence of the parasite. It's a quick and easy test, but it might not be sensitive enough to pick up infections early on, when those antigen levels are still pretty low. The Berman test, on the other hand, it detects the larva directly in the feces, and it tends to be more sensitive in those early stages.
Okay, so they're looking for different things, and one might be better at catching those early infections.
Exactly.
So luckily, the veterinary team, in this case, didn't just rely on that initial negative SNAP test, and get this, just 3 days after starting treatment for the lungworm, the dog's neurological signs started to improve significantly.
Wow, that's amazing. What a turnaround.
Right, a pretty dramatic improvement.
Yeah.
And to further support the connection between the lungworm and that bleeding disorder, follow-up blood work showed that the dog's von Willebrand factor levels were back to normal.
That's great news.
So we've got this remarkable recovery in just a few days. What an incredible outcome.
Absolutely. It really drives home the importance of considering a vasorum infection in any dog that presents with unexplained bleeding or neurological signs. Early diagnosis and treatment are key, even if those initial tests come back negative.
It's all about connecting the dots and being thorough, right?
Right.
Now let's dive to some of the specifics of this case, like those MRI findings, which were pretty striking.
Okay. They were quite striking, the MRI findings. They described this well-defined round oval mass in the right parietal lobe. It was measured at roughly 1.9 by 1.7 by 1.5 centimeters.
Wow, that's not small.
Not at all. And it was causing a noticeable mass effect. You could actually see it pushing on the falx cerebri, that membrane that separates the two hemispheres of the brain. This resulted in a moderate shift of the midline towards the left, and there was some compression of the lateral ventricles as well.
They also mentioned seeing a fluid level within the mass.
Right, a classic sign of hemorrhage, indicating settling of blood components within the lesion.
They described a thin, hypointense rim surrounding the lesion. What does that tell us?
That suggests the presence of hemosiderin, which is a breakdown product of blood. All of this points towards a fairly recent bleed.
And what about the CT scan of the chest? Did that reveal any important details?
Absolutely. The CT showed this diffuse, unstructured pattern throughout the lungs, which they described as a mix of interstitial and alveolar infiltrates. There was also noticeable thickening of the bronchial walls
Uh-huh.
and what's called parabronchial cuffing, meaning there was inflammation around the bronchi.
So these lung findings, would they align with what you typically expect to see in a parasitic infection like a vasorum?
Precisely. The lungworm larvae migrate through the lungs, causing that inflammation and damage along the way.
It's amazing how these imaging techniques give us such a clear window into what's happening inside the body.
It's truly remarkable. It really underscores the importance of imaging in veterinary medicine, especially in cases like this where the initial presentation can be a bit misleading.
The dog, in this case, showed that significant improvement just 3 days after starting treatment for the lungworm. That's such a rapid response.
It's quite impressive, and it just further supports the idea that the lungworm infection was the root cause of that bleeding disorder.
And the subsequent brain hemorrhage.
Exactly.
So how do they typically treat a vasorum? What's the go-to protocol?
The treatment typically involves a combination of anthelmintics. Those are medications that kill parasites. In this case, they used a spot-on product that contains both imidacloprid and moxidectin. This combo is effective against a wide range of parasites, including lungworm. They administered 2 doses, 2 weeks apart.
And just those 2 doses were enough to clear the infection and allow the dog's Von-Willebrand factor levels to return to normal.
That's what the evidence suggests. The follow-up blood work showed that the dog's von Willebrand factor levels had returned to the normal range. And that repeat MRI 6 weeks later showed significant improvement in the brain hemorrhage.
Really a remarkable recovery.
It is. As of the time the case study was published, the dog was clinically normal. It's a fantastic outcome.
It really highlights the importance of staying on top of things and considering those less common causes of neurological symptoms, especially in dogs that also have bleeding disorders.
Definitely. It emphasizes the need for a thorough diagnostic approach, combining a good clinical exam with blood work and advanced imaging.
Now, while this case really focused on those neurological effects of a vasorum infection, we know this parasite can also cause other health issues, right? I'm curious to learn more about the wider range of clinical signs associated with this parasite. What should dog owners be on the lookout for?
That's an important point. While those neurological signs can be quite dramatic, they're not always the first or only indication of an A. vasorum infection. One of the most common signs, and often the earliest, is coughing.
Really? Coughing? That seems like such a general symptom. It could be a sign of so many things.
True, coughing is a common symptom, but in the context of a possible A. vasorum infection, it shouldn't be dismissed. Those lungworm larvae can actually irritate the airways, causing a persistent cough.
So if a dog owner notices their dog has developed a cough that's lingering, it's worth considering A. vasorum as a possible cause.
Definitely, especially if that cough is accompanied by other respiratory signs, like labored breathing, or if they have less stamina when they're exercising.
So coughing, breathing issues, exercise intolerance. What else should we be aware of?
Keep an eye out for weight loss. The parasite can interfere with their ability to absorb nutrients. This can cause weight loss, even if the dog is eating normally.
So just keep tabs on their weight and their overall body condition.
Exactly. And any signs of lethargy or weakness.
Those also seem like pretty general signs.
That's true. But in the context of a possible A. vasorum infection, there are definitely signs that shouldn't be ignored. And of course, there's always the potential for those bleeding issues.
Right, those bleeding abnormalities we talked about, the ones caused by the disruption of the coagulation cascade. Can you give us some specific examples of what these bleeding problems might look like in a dog that's infected with a vasorum?
Sure. Nosebleeds are quite common. You might also see bleeding from the gums or blood in their urine or stool.
So any unexplained bleeding should be a red flag, right? Time for a trip to the vet.
Definitely. It's always better to be safe than sorry and get things checked out by a vet.
It seems like the clinical signs of A. vasorum can really vary and mimic other conditions.
They can. That's why it's so important to have a high index of suspicion and include A. vasorum in the differential diagnosis when a dog presents with any of these signs. It's like piecing together a puzzle, trying to put all the clues together to arrive at the right diagnosis.
It's interesting how just by dissecting this one case study, we've learned so much about A. vasorum. It really shows how things are connected, how a neurological case can lead us to understand the impact of a parasite like this on canine health as a whole.
Absolutely. It's a testament to the power of observation and critical thinking and constantly learning. Every case, no matter how straightforward or complex it seems, has something to teach us.
Before we wrap up this part of the discussion, I want to go back to something we touched on earlier, the role of genetics in Von-Willebrand disease. We know some dog breeds are predisposed to this condition. Do you think that genetic predisposition could have been a factor in this case, even with the vasorum infection as the primary trigger?
It's certainly a possibility. While the case study didn't go into detail about any genetic testing for this dog, it's something to consider. Certain breeds, like Doberman Pinschers and Scottish Terriers, are known to have a higher likelihood of inheriting von Willebrand disease.
And what about Airedale Terriers, the breed in this case study? Are they a high-risk breed for this?
Not particularly. They're not typically listed as one of the breeds with the highest prevalence. However, breed predispositions don't tell the whole story.
Right, so it's still possible genetics could have played a role, even if it wasn't mentioned in the case study.
Absolutely. And this is why taking a thorough history, including breed information, is so important when you're evaluating any dog with bleeding disorders. It helps create a more complete picture.
So genetics could be another piece of the puzzle, even in cases where a parasitic infection is the main trigger.
Exactly. Disease is rarely caused by just one thing. It's often a mix of internal and external factors that contribute to it.
Now, before we move on, I have one last question. I'm curious about the long-term prognosis for dogs that have had an vasorum-induced brain hemorrhage. Do these dogs tend to have lasting neurological deficits, even after they've been treated successfully?
That's a really important question. While the dog in this case had a great outcome, it's important to remember that neurological damage isn't always reversible.
So even with the right treatment, there's still a chance of some lasting effects.
That's true, unfortunately. The severity of the hemorrhage, where it is in the brain, and the individual dog's resilience all factor into the long-term prognosis.
So it's a matter of waiting and watching to see how things progress.
Yes, but cases like this one give us hope. They show that with early and aggressive treatment, there's a good chance for a positive outcome. It really emphasizes how important it is to be vigilant, catch things early, and provide proactive veterinary care.
I think that's a great point to transition into the final part of our deep dive. We've covered so much already, but there's still a few more threads to unravel. Ready to continue. All right, so we've talked a lot about how to diagnose, treat, and what the long-term effects of vasorum infection might be. Now, I want to take a step back and look at the bigger picture. We've mentioned that climate change could be playing a role in the spread of this parasite. Could you explain how climate change is creating a better environment for vasorum?
Sure. With global temperatures increasing and weather patterns becoming less predictable, we're seeing more and more habitat suitable for a lot of parasites, including vasorum. Those warmer temps and increased humidity can actually help lungworm larvae survive longer in the environment, and milder winters mean they might be able to survive the winter more easily.
So we might start to see vasorum showing up in places that used to be too cold for them.
Exactly. Areas that were previously considered outside its normal range might become more hospitable, which would lead to a greater overall prevalence.
That's a little worrisome. It seems like a good example of how climate change can impact animal and even human health in unexpected ways. Are there any other environmental or ecological factors besides climate change that could be contributing to the rise of vasorum?
There are a few other things to think about. One is the increasing urbanization and suburbanization we're seeing all over the world. As we move into natural habitats, we inevitably interact more with wildlife, like foxes.
And you mentioned earlier that foxes are natural hosts for vasorum.
Right. So as the fox population grows in urban and suburban areas, there's a greater chance of them spreading it to dogs.
It seems like we're creating the ideal conditions for this parasite to spread, both through environmental changes and our interactions with wildlife. It makes you realize how connected everything really is.
It does. It highlights the need for a One Health perspective, recognizing the connection between human health, animal health, and environmental health. What affects one affects all of them.
This deep dive has really given me, and hopefully our listeners, a lot to consider. It's a great example of how a single case study can raise so many interesting questions and provide insights into everything from parasitic infections to the wider impact of climate change and ecological shifts.
It shows how powerful curiosity and critical thinking can be. The more we learn, the better we'll be able to address challenges affecting animals, humans, and our planet as a whole.
Well said. I think it's time to wrap up this deep dive, but before we go, I want to leave our listeners with one last thought. We've discussed a number of factors that are likely contributing to the spread of vasorum. However, there's still a lot we don't know. What other research questions do you think are essential to address if we want to fully understand and control this parasite?
That's the million-dollar question. There are lots of directions future research could take, but a few key areas come to mind. First, we need to get a better understanding of the parasite's life cycle and how it spreads. This includes finding other possible intermediate hosts besides slugs and snails, and figuring out how environmental factors affect larval survival and development.
So we need a more comprehensive ecological study of A. vasorum.
Exactly. We also need to develop more accurate and sensitive diagnostic tests, especially tests that can detect infections in the early stages. We've seen how important early diagnosis is for successful treatment and preventing complications.
And what about developing new treatment and prevention methods?
That's another important area to focus on. We need to look into other types of anthelmintic medications, maybe ones that work in different ways, to deal with potential drug resistance. And we need to keep improving our prevention strategies, including potentially developing an effective vaccine.
Clearly, there's a lot more work to do. But I'm hopeful that through continued research and collaboration, we can make significant progress in protecting dogs and maybe other animals from A. vasorum.
I agree. It reminds us that science is an ongoing journey. And with every new discovery comes new opportunities to learn and improve the health of our world.
That's a great point to end on. It's been a really interesting and informative journey exploring this complex and often overlooked topic.
It really has. I hope it's been insightful for our listeners as well.
I'm sure they found it just as fascinating as we did. From Vet Neurojar, keep those minds inspired, hearts light, and tails wagging.